All right, it's 11:16. We're going to take a break from Wendy because we do want to get downtown and listen to the mayor right now. We are expecting Wisdom. She is going to extend the stay-at-home order a little bit longer. So we'll get a chance to listen in and hear what the mayor has to say. She is there preparing her notes. We expect to hear from her in just a few seconds.
It'll be interesting to see what she has to say, if she addresses what's going on in the surrounding areas, and if everybody is able to get on the same page. We heard Governor Ralph Northam and Governor Hogan are always talking about they're always in constant communication when it comes to how they're going to reopen. So let's
I'm
listen
Muriel
to the mayor.
Bowser. I'm the mayor of Washington, D.C. I'm here to provide an update on the district's response to COVID-19. I will share some general updates. I'm joined by members of my administration who are also available to answer questions. This morning, the district reported 99 new cases of COVID-19, bringing our total positive cases in Washington, D.C. to just over 6,500. And sadly, today, we report that 350 Washingtonians have lost their lives to this virus. So I know that many people, certainly us, watch these numbers daily. So I want us to spend a few minutes going over what it is that we are looking at and what we are monitoring as we think about our plan for phased reopening in the district. I also want us all to remember that each of these cases are people, our neighbors, families that have been tragically affected by this virus. And so our thoughts are always with those people who have been fighting it and people who we have lost. You will note on this slide our daily numbers as well as our experience over the last week. And in terms of our phased reopening plans, we will spend some time, and Dr. Nesbitt will weigh in on all of these factors that the district is watching, including how the virus is spreading through our community, our testing capacity, the capacity of our healthcare system, and the capacity of our public health system to trace contacts for every new infection. And these factors are, of course, based on guidance from the federal government, from academic institutions, including the Johns Hopkins University, as well as our local knowledge and analysis of how the virus is impacting our community. We went over some of this last week, but here again is how we are monitoring the spread of COVID in our city by watching trends in new cases, as well as looking at the rate of transmission, which basically tells us how many new infections come from each case of COVID-19. So again, we are watching for a 14-day increase in the amount of community spread. Today, we are at 4 days of a decrease. We're also watching the transmission rate and looking for it to be under 1 for a sustained period of, for 3 days. Today, we are at 2 days. In terms of community spread, Dr. Nesbitt will talk more about this, but that data point is based on more than just the number of new cases. It also depends on the symptom onset date, as well as where those cases are. For example, if they're in a congregate setting or not. So as of right now, we have a 4-day decrease in community spread. And as I mentioned, our rate of transmission has been below 1 for the second day. In terms of testing capacity, you can see right now that we are able to test in each of the 4 areas that are important to a phased reopening. We can test all symptomatic people. We can test all at-risk healthcare workers, all essential workers, and close contacts of all new positives. And we have that ability now. We still, however, don't think we're testing all of the people who need to be tested in those 4 groups. And so we continue to reach out to people, making everybody aware of the testing locations and that those tests are free. And we will continue to do that. It is also important to a phased reopening that the healthcare system can deal with new cases, can deal with increases in infection, which we know can be the result of reopenings. And so we were this past week, actually on Monday, we were at the convention center, which is part of our surge capacity. And we are also very confident in the number of new beds that have been constructed at area hospitals that are part of our surge capacity. So what we know now is that the hospitals have been operating without use of that surge capacity for over 14 days, which is very important. And finally, a huge part of our ability for a successful phased reopening is our ability to trace every new infection and the contacts of any new infection. And this is the piece that will help us ensure that we won't have widespread community transmission when we see those new infections, but we're able to keep it under control. Earlier this week, I directed $2.3 million for hiring additional contact tracers. On Monday, the Human Resources Office for DC Government and DC Health onboarded 17 new contact tracers, with at least 200 more tracers and managers to come. So you can see on this slide what our goals are with contact tracing, that we will be able to contact any new case within 1 day and their close contacts within 2 days. And so currently where we are is that we can contact trace for our priority populations and their close contacts. So building out our ability to contact trace is ongoing. The purpose of tracking all of these metrics, of course, is to ensure we are transitioning from community spread to more isolated clusters of the virus as we begin a phased reopening. And obviously, we're not there yet and not quite ready to begin that phase new opening. So today, we will extend the district stay-at-home order through Monday, June the 8th. And I should note that based on the data, I can revise this order at any time to reflect a phased reopening if the data suggests that we can do that. So we will extend from May 15th to June 8th until such time that the data say that we can begin a phased reopening. And I think everybody is aware of the Reopen DC Advisory Group and that they are working diligently to make recommendations to me on how 11 sectors in the district's economy are able to open with guidelines and recommendations. And I expect to hear from Reopen DC next week on those recommendations. And to support those efforts, I want to today announce a new pilot program. It is the Educational and Academic Retail Shops Pilot. And through this pilot, we will grant waivers to locally owned stores in the city that sell educational items such as books for curbside and front door pickup. The stores will need to agree to share data and information with us about their operations. We think it's very important for our retailers as well as regulators and DC government during this pilot phase to learn important lessons about reopening while ensuring safe operations and safe interactions with their customers. More information on this pilot will be posted at coronavirus.dc.gov, and businesses will be able to begin applying on Friday. So stay tuned for that. The lessons we know that we learned from this pilot will help all DC businesses understand and plan for challenges with reopening. But I want to be clear that in deciding when to reopen, we will continue to follow the advice of our health officials. We know, and everybody heard Dr. Fauci tell the Senate committee yesterday, that rushing to reopen could have tragic results, and we've said this many times before. We are eager to get our economy turned on, get people back to work, get kids back to school, but we know a second outbreak could be even worse. So we want to just focus on some things that we have been telling people throughout, but continue to be very important reminders. Stay home. Continue to stick with essential trips if you have an essential job, for food, for medicine, and for fresh air and exercise close to home. When you go out, wear a mask. If you feel sick, stay at home. Don't risk your health or anybody that you're in contact with. The symptoms of COVID-19 have grown. The list of things to look out for have grown in the time that we have been responding to this pandemic. So call your doctor or call our testing hotline to get a test. If you have been tested for COVID-19, you must isolate yourself and strictly isolate yourself. If you're able to do it in your home, and if you're not, call us and ask us for assistance. The testing numbers are here, 855-363-0333. In English and Spanish, 844-796-2797. And more than that, an additional number, if you need help isolating, you cannot isolate safely in your home, call us at 888-349-8323. We also have some updates related to food, which is keeping the food supply going and making sure that people can isolate in their homes. Taking care of necessities and essentials like food will help people do that. Several weeks ago, we applied for a waiver from the federal government that would allow SNAP beneficiaries to use their benefits to buy groceries online. And starting today, people will be able to do that through Amazon. So at this time, Amazon is the only retailer approved by the federal government, but we're also assisting local retailers who are interested in participating in the program with submitting their applications for review and approval by the USDA. So please, this is a very good thing. I'm glad that we were approved, and to use SNAP benefits on Amazon.com, you can go to their website and /SNAP-EBT. I also want to, before we take your questions, give a big thanks from D.C. residents to Speaker Nancy Pelosi, Leader Steny Hoyer, and our Congresswoman Eleanor Holmes Norton for fighting for D.C. residents. And I, of course, want to urge the Senate to support the House Democrats' legislation called HEROES. D.C. is specifically called out in this legislation to be made whole from the Whole Left and CARES 1 to the tune of $755 million, as well as be included in any additional state funding. So we want to thank the Democratic leaders and our Congresswoman for their hard work in making sure we were included in this piece of legislation. So with that, we will answer your questions.
Can you talk more about what this metric of sustained community transmission means? Because I think you mentioned that it's not just the number of new cases
Yes.
every day, but there's more to it.
Yes, Dr. Nesbitt?
So you'll recall that when we first talked about in a more concrete way our metrics for transitioning into a phased reopening, we made it very clear that we were going to be looking at 3 buckets related to our surveillance activities around the symptoms that we would be seeing in the community, the numbers of new cases, and our hospital capacity. Since that time, a couple of weeks ago, I think it may have been the end of April, we've had the opportunity to consult with our colleagues around the country to be very deliberative around how we are measuring the new cases. We know from a public health perspective that there's a number of ways to measure the new cases. What we report out to you all on a daily basis is the number of new cases that have been reported into us, either by lab reports or by what we call electronic case reports. And so that's just simply an accounting of new information, new inputs into the department. A much better indicator, and I think we've had this discussion before, is when we get those new lab reports or new electronic case reports, we're able to see what the actual symptom onset for those individuals are. So if you really want to appreciate the disease patterns or new infections in a community, you can actually look at the symptom onset for the district. So for us to be able to see a sustained decrease in community spread, we believe that's the best way for us to track if we're seeing that downward trend for 14 days by looking at, one, that downward trend from a symptom onset perspective, which is much better than the accounting of information into the department, and two, community spread, which is for those of us who move around the community and are not in congregate settings where we do not leave that particular setting. So we move out the data from settings where individuals have a low likelihood of spreading disease around the community. So in skilled nursing facilities, the residents of skilled nursing facilities who don't leave those facilities, and some other congregate settings that we've identified. So it's less easy for you to look at the number of new cases reported every day, and easier for us to look at this other metric of cases of community transmission.
So what does that look like for you when you do your morning data reviews? Like, do you have a spreadsheet that shows the different dates and how many people develop symptoms on those dates?
There's a number of things that I look at. There's something called an epi curve that most health departments look at. The CDC also has an epi curve that looks different than the number of cases that are reported on any global tracker that also looks at symptom onset information that is reported to them. Epi curves are how public health professionals track the presence of disease in communities, and it's why as other health agencies across the country, public health agencies, are refining their epi curves, you are now hearing more information about how virus may have been present in communities at earlier times than initial case reports may have indicated.
Yes.
For the pilot program, how many businesses will you approve, and what kind of requirements will businesses need to fulfill to be approved for it?
Well, we will have the application or some waiver specifics posted on the website on Friday. And give me the.
How many businesses will you approve for the pilot program?
We think that there is, and I haven't seen the whole list of, we've asked DCRA for a list. We think there are about 40 businesses in this category or less. So it's less than 40.
Will they have to fulfill like safety requirements for their?
Oh, absolutely. So we will be asking them what their plan is. Now, this is for curbside or front door on delivery, but we want to know about their hours of operation, how they communicate with their customers, how they'll communicate with their employees, what plans, and this is not an exhaustive list that I'm rattling off now, but how will they handle sanitation in the business and protective equipment for their employees? And other ways of communicating like signage and those sort of things.
Can I just follow up on the retail?
Yes.
So why did you pick educational and academic retail shops, and why only local shops? I guess, does this mean like a national chain of Barnes & Noble or Borders, they wouldn't be able to qualify for this?
Let me start with the first part of your question. We know that our kids, for example, have been distance learning. They're going to continue to distance learn. And we know a lot of families are continuing to look for ways for new materials and ways to make sure that kids are engaged, enriched, having fun and learning. And we know that a lot of folks are buying these types of materials online. And we also know that this is a small enough group that a pilot can be very effective. So that's why we've chosen them. And again, on the local shops, we want to make sure we're starting with our local folks and learning from them. Yes.
So Mayor, did you talk to Dr. Anthony Fauci as you were pondering your decision, and did the situation in the Maryland and Virginia suburbs where they're, I guess, extending their stay-at-home orders, did that impact you at all?
Did what? Did the Maryland and Virginia, I'm sorry.
The fact that my understanding is that the suburbs of D.C. for the most part are not going to be opening up as the other parts of Maryland and Virginia are. They're continuing to basically have a stay-at-home situation. And did you talk to Dr. Anthony Fauci?
I have talked to Dr. Fauci, and Dr. Fauci also gave a short briefing to one of the reopen groups. Yes, so yes, I have talked to him, and I think, as I've mentioned a number of times, our decisions around the district are certainly based on the data that we see and the Department of Health's recommendations. But I am encouraged that the National Capital Region and the counties in the National Capital Region in Maryland and Virginia aren't moving too quickly. I think that's good news for all of us.
And could you tell us a little more? You said basically you're extending it about 24 days.
I'm extending it to June 8th.
Right.
And if our experience, if we hit the metrics that I just reviewed sooner than that, I have the ability to revise that stay-at-home order and can do it before June the 8th, if that is our experience.
And you could extend it as well, right?
I could extend it, yes, but hopefully we won't have to. Yes.
Hi, Kim Bezier with Time Magazine. I wanted to ask if you were getting any pressure obliquely or directly from the White House. I wanted to ask if you're getting any pressure obliquely or directly from the White House not to extend for so long, and also if you're coordinating with Speaker Pelosi on when lawmakers would return because of the impact on city voters.
I am not getting any pressure from anybody that you mentioned to reopen. And you said, did we coordinate with Speaker Pelosi? I have spoken directly to Speaker Pelosi, and Dr. Nesbitt and her team speak directly with the intending physician for the Capitol. And what was the?
Do you have any idea on when lawmakers have you encouraged them not to bring all of the lawmakers back?
I have not. We know that government is essential, and the work of the government is essential, especially our lawmakers. So what I have encouraged the federal government to do is to keep as many people on telework as possible. And we recognize that there will be parts of government where people have to report to their offices. Like in the case of DC government, about 40% of my employees have to report to their offices, but 60% are able to telework. And so I would expect the Congress to have a similar evaluation for their workforce. Tom Fitzgerald.
Hi, Mayor. Good morning. Thanks for doing this.
Thank you.
Can you hear me?
I can. You can go with your question.
Okay. I wanted to ask you about testing because in covering Dr. Fauci's testimony yesterday, one of the things Dr. Fauci said was that the road to reopening runs through testing. So I want to ask you about testing in the District of Columbia. The Harvard Global Health Institute just came out with a survey nationally, and it looked at DC's number, saying that from the period between April 30th and May 6th, DC conducted 822 tests a day. It calls for a minimum daily testing needed by May 15th, which is just 2 days from now, of 5,857 tests today. So you laid out the 4 criteria of groups at the beginning of this that are getting tested, Mayor, but the question is, on May 13th, can someone in the District of Columbia who wants a COVID-19 test get it?
A person who needs to get it absolutely can get it.
Can everyone get one?
Does Dr. Nesbitt, I'll let you go to that question.
Right. I am very familiar with the study that you are referring to, and I will say that there is no agreement in the public health and the healthcare community on a per capita amount of testing that should be done across all jurisdictions. And so we find it very challenging to have or to set these goals for per capita testing. Now, what I mean by that and what the mayor articulates with her comment is that everyone in the district who needs to be tested can be tested, and we have the capacity to test everyone who needs to be tested, which is different than posing the question of if everyone who wants to be tested in the district can be tested, and in fact, should they be tested. The tests that are currently available are diagnostic tests that are intended to detect current infection in individuals. An individual who has had no close contact with an individual who is positive for COVID-19 and who has no current and/or who has no current signs and symptoms would not be appropriately using the diagnostic tests that are currently available. Then that raises the question of the appropriate use of serology testing, which is intended to determine an individual's past exposure. We have not yet made those tests widely available in the district. They are available in some limited capacity. So an individual who wants to use a test that determines current infection, who has no current close contact exposure, which we clearly define in all of our health alert notices, would be inappropriately using a test. And so we would take umbrage to any recommendation that squarely suggests that we should have these goals of just simply testing a certain number of individuals every day for the purposes of meeting per capita goals.
But I will say, and thank you for that explanation, and as I said earlier, Tom, we don't think all of the people who meet those 4 criteria are getting tested. And that is why we are always putting out the number. We added sites, and we continue to add sites. I've asked Dr. Nesbitt to work with our community health providers and our hospitals so that they're being more aggressive about reaching out to their patients and their communities about the availability of testing. A lot of these groups, for example, have been funded federally to respond to COVID, and so we want to work with them to make sure that they are using all of their capacity and all of the capacity in the district. I've also asked Director Geldhart to work with DFS our MOCR staff about fully utilizing our mobile testing capacity and getting out in the community. And we look forward to making those schedules available in the very near future, so that we're all over the city making sure people that are essential, that are healthcare workers who have had symptoms or who have been exposed to people who have symptoms or who have tested positive are getting tested.
And long-term care facilities.
And long-term care facilities. Thanks for adding, Doc. James?
Yeah, real quick, pilot, how long is the pilot supposed to last?
We don't know what the stage will go from this curbside pickup. And we are designing it very quickly. That's why I don't have all of the answers to your questions right now. So we will include that in the application. Thinking out loud, it's a good possibility that these pilot participants can report back. If they say none of this works and scrap it, I can't presume what the results of the pilot will be. Okay, yes, sir.
So if I understand the presentation right, it sounds like we're in a good place for the healthcare metrics for reopening with hospital capacity, with testing, but what we need to see is the sustained community transmission. That's really the missing piece in order to reopen safely.
Yes. Did I miss anything? I don't think I missed anything. Okay, any other questions? Yes, Sam?
Yes, Mayor. I guess it was last week or the week before, we got the impression, looking at the numbers, that the highest rate of positive for COVID in D.C. was probably the Hispanic community, looking at Columbia Heights and I think 16th Street Heights. Any particular efforts to focus on that community, given those numbers?
Yes, and I think Dr. Nesbitt reported that the number of positive cases to population of Hispanics in Washington, D.C. showed that they had the highest rate of infection. And we are very focused on testing and isolation. And we're going to also have a focus on some of the other things like mask wearing. So we're looking at the whole communication strategy and testing strategy that will help us move the dial.
Also, there's a group called, I think, Black.
All right, you're listening to Washington, D.C. Mayor Muriel Bowser there giving an update on the COVID-19 situation in the district. One of the headlines coming out of her conversation at the press conference today is that she has extended the stay-at-home order until Monday, June 8th. The original date was May 15th, but it has now been extended to Monday, June 8th. Basically, stay at home, continue to wear those masks. She also mentioned that she could revise it either one way or the other, depending on the information that she gets from the people in charge and the people who are keeping a close eye on COVID-19 and how it's spreading in Washington, D.C. Steve.
I mentioned that hospitals at about 76% capacity right now when it comes to the treatment, which is respectable compared to where they expect it to be. And basically saying, Wisdom, that right now they are essentially at a good place. But the mayor taking the extra caution of saying, let's extend this to June 8th right now, with the caveat that if the numbers continue to be at least not worse, we should say, hopefully turning better, she can shorten that at any point. It'll be interesting, though, because Governor Northam told us earlier this morning, Wisdom, on Good Day, that he wants to keep Northern Virginia kind of in concert with what Washington, D.C. and Maryland is doing, at least the Maryland suburbs close to D.C. We're going to get more from the governor of Maryland on that plan coming up this afternoon. So we'll see how it plays out. Thanks for being with us and sticking around. We'll continue to stream this, and we'll have a full wrap-up of the mayor's comments coming up on at 4 o'clock right here on Fox 5. Updates, of course, on our social media and digital channels throughout the day. And we'll have Governor Hogan for you speaking this afternoon as well. Make sure to join Wisdom and Aaron tomorrow morning starting at 4 a.m., and we'll see you then. Good day.